So today we're going to talk about tinnitus. I would suppose that most people have probably had some form of ringing in their ears. If you're really, really quiet in a really quiet place and you listen carefully, you probably have a little bit of ringing in your ears. That's what we call tinnitus. Any kind of noise. It can be ringing, whooshing. I've heard it described as a lot of different things. Is what we call pulsatile tinnitus. That's tinnitus that goes along with your heartbeat. There are a couple of reasons for that aren't as concerning, but should still be checked out anytime you hear pulsatile tinnitus. The first one is if you have wax in your ears that's completely obstructing your ear canal, then sound can't get through that and you may hear your heartbeat inside your ear. Once the wax is cleaned out, that usually resolves and you feel fine again. The other thing that can cause you to hear your heartbeat in your ear is if you have fluid behind your eardrum, and that also needs to be treated. Usually when that resolves, then that sense of your heartbeat in your ear goes away. However, if you have pulsatile tinnitus and you don't have either of those other things going on, then that needs a medical workup. Frequently it requires blood work to be done. It also requires an MRI to make sure that there's nothing going on behind the parts of your ear that we can see in the office. However, the most common form of tinnitus, or ringing in your ears, is the form that we see all the time, and that's people who just walk in off the street and they have constant ringing. It may be soft, it may be loud, but it's there no matter what they're doing. And it tends to drive people pretty crazy. This kind of tinnitus is frequently related to some form of hearing loss. So if you come into the office and you have some ringing in your ears, the first thing we'll do is take a look. If there's nothing that we can see going on, then the next thing is to get a test of your hearing to see if there's anything wrong with the hearing. If there's a difference in your hearing, then usually we say that ringing is related to your hearing loss. The nerve probably has made some adjustment, or the brain made some adjustment to the fact that now the ear is no longer hearing the way that it used to, and now you're perceiving a sound in your ear, and that sound is then a ringing of some kind. The other thing that happens is when we see a difference in the two ears in your hearing test. So one ear's hearing fairly, maybe down, but it's at this level, but the other one is different. And if that happens, then we need an MRI to see if there's something that's going on with your ear behind the part of your ear that we can see, to make sure you don't have a tumor in your ear behind the cochlea. If the hearing test comes back and you just have decreased hearing in both ears, then usually a hearing aid can be helpful to get rid of the ringing sounds that you have in your ears. If you don't have enough hearing loss to cause you to need hearing aids, the other things that we talk about that can cause you to improve your tinnitus are decreasing your caffeine and your salt. Caffeine and salt are things that we know that cause stimulation to the inner ear. So for some people, cutting back on the coffee that you consume can make a big difference. Or the numbers of chips and salty foods can make a difference as well. If all of that doesn't make any difference, sometimes we use things like B vitamins, lipoflavonoids, things like that will improve things. It depends on your individual situation. So what we'd love to do is get you in here so we can take a look and see what's going on and find out the best way to help you. Inevitably, you will wind up with a hearing test, which overall isn't a bad plan because it's going to give us a good baseline sense of what your hearing is. So some things you can do at home, kind of get a sense of if it seems like you're hearing the same in both ears. How loud are you turning your TV up? Is your family complaining about what you're saying, or are you not hearing what they're saying? If you're saying what all the time and you're driving your family crazy, it's time to come in and see us, because we need to figure out what's going on with your hearing. And if that ringing is driving you nuts, come on in, because we might be able to help figure out what's happening with that.